Everybody, welcome back to another episode of the Bulletproof Dental Practice podcast. I'm your host, Dr. Peter Boulden, with my esteemed co-host. See, Craig, look how nice that was.
That was very nice, Peter.
Dr.
You must be
Craig
feeling nice
Spodak.
today.
I am. I'm excited. I've got a new friend and someone I've reached out to just personally to help me navigate through some dental tech concerns of my own. Dr. Aaron DeForest, host of the Dental Tech Up YouTube channel.
Hey, how's it going?
Good,
yep,
buddy.
That's right.
Good. So, Aaron, I'm going to give everyone a little context to how I found you. So, I was right before we hit record. We actually were talking about dental software and how Craig was kind of relaying his pains about the fact that he's on Dentrix and it needs this to talk to this to talk to this. And so being with EagleSoft, I gotten so frustrated that I'm making the pivot to an enterprise cloud-based solution, of which Aaron had put some YouTube videos out there that really were very helpful in answering my questions. So I had some deeper level questions, reached out to Aaron. I was really stimulated with what he was doing and just the whole thesis of what he's started a YouTube channel on, which was dental tech and how confusing it is for dentists. And we just had a good conversation. I was like, man, you need to come on the podcast and tell everybody, the cool tech shit that's happening in dentistry. So here we are.
I appreciate it.
Aaron, where are you located, bud?
I'm St. Louis, Missouri.
Okay, nice. And you just got out of school, if I remember us talking correctly, right? Maybe the past 5 years?
Yeah, 2017.
2017. Okay. And you practiced with your father, right?
Yep.
Oh,
yeah,
cool.
That's kind of how I got
awesome.
into all this.
Me too.
But they have totally different softwares, totally different practices.
Wow.
And that's
cool.
how Aaron had found the software that I'm converting to at the turn of the year, beginning of the year rather.
It's called transitioning to, by the way, I think, not converting.
Well, yeah, I guess you're right. It is,
no, I'm just giving Pete a little. I'm sorry. There's an inside joke I just had to sting Peter with real quick. Hey, Aaron, I got a quick question for you, bud. How long's your dad been a dentist?
My dad's been a dentist since 1985. So
okay, so
he's been going on pretty long now.
So how old is he now?
He's like 60, 61.
Oh, so yeah, that's to Peter and I, those are young guys, but it's pretty common. I work with my dad. My grandfather was a dentist, and it's interesting, isn't it? I could tell by having separate softwares and everything.
Yeah, Craig's family invented dentistry. There's like 19 generations.
Right. Well, my uncle G.V. Black once told me. He said, "What did he say? Extension for prevention."
He said, "Cut the shit out of some teeth and hope it stays in."
Yeah. Methinks we should cut thine teeth.
That's pretty funny. Yeah. I mean, that's just kind of how I got into everything. I came into his practice and I just looked around okay, well, actually I convinced him to buy this pano before I even got out of college.
What is this pano you speak of, Aaron?
Yeah, I know. So I got him to spend, like 10 grand on it, which, is pretty good for a pano, I think. And then I went to install it. And I was like, wait, I had to check to see if it worked with the software. Everything just doesn't work fluidly. So I spent some hours and finally, found some Twain drivers and got it to work. But it just blew my mind how far technology was from being fluid,
And that's been the theme in dentistry. You see that with, closed loop systems, CEREC and some of the scanners we've got. And so obviously the software, by God, it's all closed garden.
CEREC's open now, by the way.
I know, but
I know. I'm just yeah, I know.
It was we have proprietary this, proprietary
well,
that.
Look at the supply houses too, Pete. We can't even sell that. You have to go to Patterson or Shine. There's even that. You can't even buy it, from one source.
Why can't everything just be open source? Everything needs to be open source.
It will.
We all fight for open source. That's just the way that the tech world works. And it's just so funny how tolerant we've been in dentistry about allowing proprietary this, and still being yeah, I'm going to sign up for that because that's cool. You'll just hold me hostage in perpetuity. I'm down with that.
Yeah, sounds good.
And every dentist has to be their own has to do their own research on every technology. You see a bunch of dentists saying oh, well, this is what I use. This is what I use. I went to YouTube, try to find videos on the cloud software, and there was nothing.
Nothing.
And I was well, if I'm going to do the research to determine what I want to buy, I might as well just put it in a video and, put it out on the internet and help other people so they don't have to do the same thing.
But you've done that a lot with more than just software, right? Because as Craig said before we hit record, dental software doesn't light me up.
Right. Yeah.
So
then
I was just keeping it real.
Yeah, no, it's fair.
Hey, it's fun. After your last podcast, Craig, you just want to stay real, huh?
I want to stay woke.
Yeah.
Pete and I went to woke school just in our last podcast. Woke school. We won't mention any names, but it was woke training.
Okay.
I didn't realize. So I didn't realize this. Yeah.
So Aaron, you're starting a channel to stay on the precipice of dental tech called Dental Tech Up, and so you're going to be reviewing lots of products, giving your insight and feedback from the clinician side as well as the tech side, correct?
Right. Yeah. So pretty much I've been reviewing intraoral cameras lately. I reviewed the Shofu iSpecial C3 camera, which is more like a point and shoot camera made specifically for dentistry. Do you? Yeah. And that's one of the cameras I feel like a lot of people don't even know about.
Yeah. I've had it for like 4 years.
Yeah. And I actually think there's a lot of like,
what's the price point on that?
I think it's right around $2,800. So it's a hefty price tag versus, a regular, DSLR camera.
SLR,
yeah.
All right, so let's, as opposed to like, why don't we talk about why you like that? I kind of want to go through some of the tech because honestly, as old school as camera technology is, I'm gonna say obviously it's not as fancy as 3D printing and stuff like that that's coming on the market. But from a return on investment standpoint, there is still nothing higher than quality intraoral shots, whether that be occlusal or whatever. So you can really do a lot of dentistry and educate a lot of dentistry in your chair if you've got the right high quality photography. Yeah. What floors me is that how many dentists do not take any kind of photographs whatsoever. So literally it's communication via, just trust me, there's a crack in this, right?
Hey, Pete, do you, just a quick housekeeping item, I don't know this about your practice, but do you take a series of retracted and intraoral shots on every patient?
We take 10 on every new patient.
Me too. Yeah. Every single patient.
And actually, Craig, and I demand from the hygiene side that when we come in to do a check, there is an occlusal.
Me too.
The occlusal up on the screen.
Me too.
On the TV in front, like that is what I want. I don't want to see X-rays. I want to see occlusal, because at the end of the exam, that's what we're going to start discussing, and the patient gets to look at that and say, "God dang, that's those fillings are ugly."
No. The first question is, whose mouth is that?
Yeah, whose mouth is that, right?
That's you know what's so funny when patients say that, like, is that my mouth? And I always say the same thing, like, oh my God, no, that's actually, and their name is like Claire Jones. I'm like, that's Claire Jones's mouth. Oh, that's you. Yes, it is your mouth. Just to like mess around with it, just to be funny. But no, I sometimes.
So Aaron, tell us how, and one thing I've struggled with, I have a house full of DSLRs, and the team, let's just say it's highly technical because there's all these f-stops and this and if someone tweaks the camera, now no one knows how to fix it. So I'm guessing the problem that you're solving with this, I think you said Shofu, is that it's point and shoot. It's let's just say it's not, I don't want to say dummy proof. It's just, I want to make sure it's the simplest solution to things not getting messed up in our offices, which they do.
Right. So I think like their main thing that they try to do is they try to make it for assistants. And they try to, it's only like 1.3 pounds. So it's really like lightweight and you can hold with one hand. But the thing is, it has like 8 different modes on it. So like everything is like picture based on this camera. So you kind of choose what mode you want. If you want to just do standard mode for like orthodontics, or kind of maybe just, take regular pictures that you would compare to like surgery pictures where the person has to be farther away. But what it does, once you choose a standard mode, then you actually have, how normal zoom, it tells you like 1 zoom, 2 zoom, 3 zoom, and you just kind of guess where you need to be. Well, actually at the zoom, it has pictures of the teeth. So all the way zoomed in shows you like maybe 1 to 2 teeth, if you're doing like anterior shot, where if you medium zoom, it's going to be, it's going to be the smile. And then zooming out even farther, it's going to be even, bigger. It's going to maybe show the chin also. So it's kind of telling you, okay, what image do you want to do? And once you choose that image, then it tells you how far away you need to be from the patient, the actual camera itself. And then once you're at that distance, you can kind of hold the shutter button halfway down, and it will light up green if everything's correct. And
We use them all the time. We got 4 of them here, 5 of them here.
Do you really? All right.
Yeah,
So there's
awesome.
there's a lot of value in that. Even though the price tag kind of just startled me, I see a lot of value in that.
Well, I mean, listen, if it mitigates training, it's worth it. I mean, staff overhead has the largest percentage of our business, all of our businesses. So if you can take someone and make them into a great photographer really quickly, that's going to be worth it. You said something, Aaron, right before we hit record that I want to touch upon, which drives me batty. You said that, when we were talking about a software, you said there was no dentist anywhere near them when they designed this. And I just find that in general, dental products, not just the dental products that are designed for us as dentists, but dental products that are designed for the consumer. I'm like, I don't want to mention names, but there's a special toothbrush that's very popular, right? I picked it up. It's very, very popular right now. I put it in my mouth and I realized the head is not vibrating. The handle's vibrating. So
really,
it gives the sensation that, well, my hand is going crazy. Shit, this must be getting the crap off my teeth. And I tested it like rudimentary. Like I put the handle in water and it effervesced, and I put the head in water and it effervesced less. So it's like,
I think that's fake news. That's fake news. There's no way that the popular
yes. I don't want to talk about it. Leave it alone. But it just goes to show me that there's a bunch of people sitting around in many aspects of our industry, both towards the consumer and towards the dentist, where there's no freaking dentist anywhere.
Right. It's like everyone's looking at like, how can I get a piece of this dentistry thing without having to go through school?
Right. Hey, let's cook up let's do Endo Direct Club, right?
Right.
Hey, how do we get that? The silly dentists, they don't know what the hell they're doing.
Right. So that's another thing that I'm trying to do. I'm trying to do videos that are specifically for dentists so they can realize what they want to purchase without actually having to purchase a product or talk to anyone else. I also want to get to the point where I can influence how dental technology and software and all that is made so that it can be, for dentists, not by dentists, but at least help them do what we want, or maybe what we don't even know that we want. Because that's really what I'm looking at. I'm trying to look past what everybody else, I feel like, is just looking at each other saying, oh yeah, I can make a version of that. And it's like, well, what do dentists want in the future that like we don't even know that we want? And that's what I'm excited about, honestly.
Can I ask you something about the cloud real quick? Because I'm gonna show how dumb I am with this stuff. But
it's all good.
Big dumb animal.
Big dumb animal. That's what Pete's new name for me. Thank you. I told you, Pete, if you call me, I'm gonna get really pissed. It's on right now. That's like the worst thing you could ever call me. Big dumb animal.
Hey, Aaron, he's 6'5", so it's
I actually told him that, like, Pete, do me a favor. He's like, what's up, bud? I'm like, just never call me that. And he just freaking did it.
Not only did I not call you, I waited till a podcast to say
right. All right. I'm gonna let that slide. Don't you're gonna ruin my whole train of thought here. So the cloud. So from what I understand, that the difficulty is in imagery, right? So is in a practice management software that's cloud-based, are the images hosted locally or are they stored in the cloud as well?
So depending on what you use, depending on the software you use, they're stored on the cloud.
Got it.
If you're, depending on obviously what you're, if they say they're stored in the cloud, they're going to be stored in the cloud. The hard part is getting maybe the technology, the camera, the software that works with your cloud software.
Okay.
So what I've kind of found a little bit is the more expensive, cameras and stuff, is they really have the kind of resources behind them to create the technology for the different softwares. So not only is, you get a little bit, better product with a more expensive camera, they actually can back up their support and create technology that will help, work with the cloud a little bit better.
And is the lag an issue bringing down those big images? Or it can't be as fast as having it locally, can it?
You can't have dial-up anymore, Craig. You got to upgrade.
Right. So the images,
right.
I don't
Wow, you're in a tear today, Pete. I'm storing all these freaking things, bro. I'm gonna freaking launch on you in a minute. I'm gonna go toe to toe with me.
So the images really aren't as big as you would think. Like they're not your phone images, okay. They're not like 10 megapixels or anything, crazy like that. The file size is pretty small, talking about if you do, show food or stuff like that, you might have after, thousands of patients, it may play a role, but I really don't think it's going to be like lag like you might be thinking. Like
because my database is stupid. I know that it's like like I don't know. I'm gonna blow this whole jargon, but from what I understand, it's like a lot per day, like a terabyte per day or something stupid.
No, it's not a terabyte a day.
I'll find out what it is. I don't know what it is.
You're not the Library of Congress. Come on, come on.
No, I'm going to find out what it is. So just keep talking amongst yourselves.
A terabyte a day.
I don't know, man. I said I don't know what I'm talking about.
Hey, Craig.
Yes, sir.
It's a good thing you're handsome.
Well, thanks for softening the blow there.
I think it also plays a role if you're on a shared driver versus like a personal driver.
That was actually something that I chose to look for too, was that, Greg, some of these cloud softwares will actually commingle, if you will, data, and they'll put it into a big pool. So you have to look for one that is not shared. It's your own allocation of cloud. And right now, AWS is kind of, Amazon's web services is kind of dominating that space for cloud computing. But it actually, Greg, it's cool. There's compression technology. I mean, it's no different than like Netflix. You'd think like, how the hell do we stream a damn an HD movie?
Yeah, it's true.
To our, right? And so there's compression technology back there that allows for it to come through. Cool. And so we're not even doing a movie. You're doing just static images.
So from what you're saying, then it's not an if every PMS will be cloud-based. It's a when. It's absolutely going to be a when, correct?
It should be, and it needs to be, in my opinion, because it's been the biggest. And hear me out. It's been the biggest impediment to my growth has been my software, the number one thing. Right.
And I think
I finally. Go ahead, Aaron.
No, I think it's going to grow into something more important than we actually realize. Like, we kind of have an understanding of what we think practice management software is right now, but I think in the future, it's going to be much bigger and be much more important than you think, because it can do it's one of the few places that computers can definitely automate dentistry in a dental practice.
My database is 4.5 terabytes total. So
that's all your CT stuff though.
4.5 terabytes. Yeah.
Yeah.
Not 1 terabyte per day. Although I like that. I'm just gonna stick with that. 1 terabyte per day.
$1
million active data is what he's saying.
Aaron, let's pivot to
no, I'm not done yet, man. I'm not done. I'm not done. I want to keep going. I want to go deep down. So Aaron, you mentioned something that was enticing for me, and it's hard to get me even to pay attention when you're talking dental software, but you said, I think that the practice management software is going to be something that's totally different. Can you give me what you believe it's going to be? Like, I'm just curious what your vision is.
So I can tell you part of my vision. I mean, I kind of touched on it a little bit, but I think because it's one of the few things that can be automated, it can be the most, like, AI and stuff like that being used. That can play the most role in that versus other parts like of dentistry where everything kind of to a degree has to be done by a person.
Aaron, how techie are you, Aaron? Do you know what GitHub is?
I've heard of GitHub. I've talked to someone that's using it, but I didn't really look into it.
So I love how you're touching on AI, because Craig and I are actually about to speak about in a month in Whistler at a conference from Arum Labs. And
can I just correct you?
What?
Aurum.
I know.
Aurum. It's okay.
I don't know why I slowed that together. Anyway.
Aurum.
Aurum. Yeah. Thanks for the correction. Anyway, it's literally speaking on the dental disruption, the things that are happening in dental disruptions. And obviously tech, whenever you talk about disruption, tech plays a massive role. And so there's hardware disruption, there's software disruption, and then there's industry disruption. And so when I started looking at doing some research for this presentation, I was looking at, what is going on in terms of AI diagnostics, because that's going to play a part in the integration of the software. And what I found was that there's actually people developing. So GitHub is a repository of people creating code for specific things that are solving, right? And it's kind of a shared database of just people doing whatever they want. And there was actually already a dental diagnostic AI open source coding for AI that identifies if it's a tooth or an implant, the restoration. And so what I was thinking to myself was, wow, this is going to save millions of hours of dentistry time, millions of human hours per year in dentistry if this gets put in, because we take an X-ray, we take pictures, and then we chart it out, and we write in, color code the chart and do this and that. Imagine if a computer could digitize and do that for us. Think of the millions of hours that it would save.
I mean, just think about
just one
intraoral
example,
cameras.
Right?
You use an intraoral camera and it just gets the picture and it automatically charts everything.
Totally. Yeah, that.
Imagine that.
And using intraoral cameras and then applying like the DSD stuff or Kappa Nu stuff, where you're actually able to augment, from an augmented reality perspective, be able to put up stuff that, this is what it'll look like. Hey, Ms. Jones, when we replace this implant back there, this is what it'll look like, right? Like, why shouldn't we have a Snapchat filter that shows Mrs. Jones the dream of filling in, and why it looks better to do that versus, so it's just a cool time. And I think there's a convergence of tech and dentistry happening. And I think, medicine seems to get it first with a lot of cool stuff, and dentistry gets it after.
Well, just imagine the AI on a patient intake software. So like in the medical history, like, do you snore? Do you have hypertension? Do you have clenching, grinding? Then it automatically spits out like a video that's prepared for them. Like, based on the answers you've written, we think that, you might be at risk for sleep apnea and periodontal disease and blah, 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 blah. It's so easy to give, these algorithms. I mean, that's what medicine does. They just look at a confluence of factors. It's been 7 years since my last dental visit. My gums bleed. Clicking all these things. Like, based on the answers you just gave, you may be at risk for periodontal disease. If you'd like to learn more, click here. You know what I'm saying? It's just this intuitive thing. By the way, I just texted you a business idea, Peter.
Yeah, I figured. My brain's kind of going crazy right now too.
Yeah.
So, Aaron, I love that you're literally created a channel. When I first discovered your channel, in full disclosure, I was like, what's he going to talk about? Like, going forward. And you were telling me kind of the vision and the goals and the dreams you had for this channel. I was like, that seems hefty. But now that I think of it, and Craig even spinning off business ideas secretly behind the scenes to me here, it's not only going to be cool for you because you're going to become obviously the influencer in that space of a much needed thing, but dentistry is going to become more and more tech. And like I said, as I've unpacked this presentation that Craig and I are going to do, there's robotics and there's AI and there's cloud and there's blockchain. All these things are tech.
Yeah.
Right. And it's going to be tech to make things in our life as dentists easier, better, faster. But you better be aware that you will potentially be disrupted, and disruption isn't bad. It just means keep your head up.
Right. Yeah. No, I agree.
And
it just depends on what your appetite for disruption is.
What is your appetite for disruption?
As Axl Rose would say.
Welcome to the jungle, baby.
You're gonna If you want it, you're gonna have to pay. That's it's the price you pay to be in the jungle.
I have ideas that there's ideas that I have that I'm, obviously keeping to myself, but the way that dentists can disrupt, and it's just not being done yet. And I think everybody's looking at how things are going to disrupt dentistry, but I think there's ways to use this technology to disrupt everything else with the use of dentists.
Unpack
and I think
that if you can.
Yeah, I think that's cool too.
So I want you to unpack that a little bit more.
Well,
he's got some cryptic idea. Yeah,
because I have to get to the point where I can influence companies to want to listen to me instead of me just sending emails to people and be like, well, who is that? And, not answer me back or whatever. But I think there's ways for dentistry to disrupt other fields without, instead of everybody just looking at us, how about we start looking at everybody else too? And that's
hefty.
Well, look at 23andMe. It's a company based on spit, right?
Mm-hmm.
The whole thing is spit. So it's
well, it's based on genomics and
right, but the medium is saliva. That's our territory. We own saliva.
Right. Beat it, 23andMe.
Yeah, beat it. Go take some blood or semen. Come on, man. That's our area.
That's right.
Craig.
What?
It's PG, isn't it?
I don't know. I guess it just became PG. Aaron, how old are you? You look quite young. Are you over 21?
I am.
So
Yeah.
then fuck it. We're fine, Pete.
29.
We're fine, Pete. Don't. He's just worried because you look young. And
oh, because I look young.
No,
he's
I'm kidding. I'm kidding.
Yeah. I think I saw a patient the other day that like looked at me and was like so confused that I wasn't 60 years old. And I was like, oh, hi.
Hey, you guys got time for a story?
Dr. Nose and Ears. Dr. Nose and Ears.
Do you have time for a story? So I work with my dad. My dad's 78 now. When I joined the practice, he was like 70, right? I'm sorry, he was 65. What the hell am I saying? He was 60 when I joined the practice. So we had a patient, and there was a lot of confusion about which Dr. Spodak people wanted to see. So the patient had my dad work on them, and at the end, said to my dad, listen, you were very good. I wish you the very best of luck, with your training. But do you mind next time if I see the older Dr. Spodak? And my dad was like 65 years old. It's like, my dad's like, I'm 65. You're 52. Like, how much older do you want me? That's freaking crazy.
That's something I've never heard that story. I've heard lots of your stories, sometimes multiple times.
And you never stop me, which is so nice.
I love it because they're just so charming.
Hey, you know what? My IT guy, because I've been texting him like crazy, he's telling me about all this stuff. He's saying, this is what you have 4.5 terabytes. He says, what do you pay per gig is the question for data only. You pay 10 cents a gig. So I just joke around. Can you do it for 9 cents? He says.
So Craig, wait, hold on a second. So you're talking about, he's probably talking about backup.
I have no idea,
because you have your own server.
Yeah.
Yeah. So you're talking about backup.
Yeah. But he wants me to mention him. Clear Dental, Tom Orlando. There you go, buddy.
No plugging.
Okay. Delete that.
Plugging all day.
No plugging. Jeez.
Oh, I don't know. Aren't we plugging Aaron right now?
That's right.
No, we're extracting value, Craig.
Oh, that's true. Okay, strike that for the record then. Yeah.
That is the thesis of the podcast. Jeez.
But since I brought it up, this podcast brought to you by coffee.
Aaron, let's talk about, so we've talked about cameras, we've talked about some cool software. What other trends or like low-hanging fruit in the tech space do you see?
Let's see. I mean, cloud software is definitely the big one that's obvious. Internal camera, digital x-rays, I think the whole integration thing really needs to be one of the things really looked at by these companies. So it's not a specific product, but it's these companies saying, hey, we're going to work together.
You mean going more open source? Or
at least open source
or Twain drivers, because Twain's a protocol that allows for, it's agnostic with who it works with, if you will.
So I think.
Twain? Did you know Twain was actually a pen name? That was not his real name. I know. I don't know. You knew that. Pete, you're so pissed. You're so pissed. Look at your face. You're so freaking pissed. So you guys want me to just tune out for a minute? Check some emails.
No. Just because you're the anti-tech up dentist doesn't mean that you can have.
That's right. Anti-tech. Tech.
I'm sorry. Go ahead. I'm fine.
So I think these companies are not realizing how willing they are to work together. Because I talk to all these companies. I usually even talk with the tech people of these companies, like getting to use their stuff. And they're all like saying like, yeah, we're willing to work with whoever. Just like, just hit us up. And I don't think anybody hits them up. And they just, they kind of just sit there and do their own thing. And I think they could really be focusing on working with each other and making the products work, better with each other and more, and I think that's the low hanging fruit that dentists can't specifically buy, but they can say, hey, how about you go out and actually work with the product I already have instead of, try making me maybe buy a different one or whatever.
Yeah, but as a paying I mean, I hear what you're saying. So you're saying most manufacturers are open to suggestions from the industry.
Right.
You're saying, right? Yeah, I think that's tough. Like Craig says, a lot of dentists just don't know what they need. And honestly, if you're a paying customer, sometimes you feel like, well, you should have an R&D. I don't know, we got enough to do.
Right.
And that's lean into the people that we're already paying.
And that's what I'm trying to do. It's okay, how about you have one guy who's just kind of taking it for the team and just focusing on dental technology, so that everybody else can learn about it and he can still kind of play a role and try to make this all work a little bit smoother. instead of every single dentist trying to do it themselves. And now it's just trying to gain the influence to get there.
Yep. And you have, and I know that lots of manufacturers have reached out to you in that regard. And obviously, probably they want to get featured on your channel. But in the same, you are going to become the spokesperson and the proxy from a clinical standpoint to the technical standpoint, which is good. Because I think you've got a good grasp on, where the rubber meets the road, if you will, right? When you're practicing versus like, okay, this is a cool feature, but like, they just made the life of my assistant really hard. Right. Or something like that. I'm going back to the software.
And that's why I usually, my videos are pretty much informative. I try to show everything that I can. Like I use screen recording of everything. Any pictures that I take, I usually put them on a Google Drive and put them down in like the video description so that you can just download the image and see what it looks like on your own computer. And it's not really me saying like, hey, you need to buy this product. It's like, hey, this is the product. This is what it does. And then I move on to the next video and same thing,
Hey, Aaron, actually, I thought of something that we had talked about prior to, and I really wanted to ask you this question. So I am a fan of the isolation devices, right? And so you had mentioned talking about like you look at ISOVAC. So how there's that one you can get on like eBay or something. It's like a metal thing. It basically just like, I don't know what it's called, but it's a piece that basically it's not as fancy. It doesn't have all the lights and stuff, but it's nice to have in every operatory. You know what I'm talking about?
Yeah. Isolite and all. Yeah, I know what you're talking.
Yeah, I know it's an Isolite, but there's one that's called a Kona. It's called a Kona adapter. You ever heard of that?
Hakuna?
No, Kona.
I'm just wondering.
So look in Kona adapter because it can use the because you can't afford to have Isolites and all that stuff. They're great and they are a time saver and they're amazing. And sometimes you look up and you're like, your assistant can check her Instagram if she wanted to. But these Konas are we've used a lot, even for a hygiene perspective.
How do you spell that? Kona? Kona adapter?
Yeah. It was
Dry Shield. Kona adapter Dry Shield. Wow, good for them. Yeah. Oh, look at this. It's on Amazon, bro.
Yeah, and it's like 50.
Well rated.
When I bought it back in the day, it was like $50 or something crazy, and it was just
it's 115 now, but it's well rated.
Well, yeah, it's a game changer. If like let me go back and preface it. It doesn't have lights, it doesn't have all this stuff. But if you need something in all your operatories that's ready to go, and you can kind of just leave it there, it's pretty neat because the isolation. Again, you just throw in an some of those retraction suction things, and you're ready to roll.
That's so cool.
I just didn't know it. I didn't know. I know that you had reviewed and looked at ISOVAC versus some other things, but I didn't know if you were aware of some of these bootstrapped kind of devices.
Oh, there's a cool one here. Like I'm looking on Amazon.
Check it out.
It says dentist wireless rechargeable oral LED light with a bite block and a suction tip for $70, and it's really well rated. It's super badass on Prime, $68.
So that's another thing, Craig. So we talk about disruption some, right? So Amazon is a good resource for looking at like cool technology that we just don't see in our dental literature.
Well, it's the reviews that are the most important thing. Like I would love to know what you think of this bonding agent, or, we don't have that. We have like, Facebook, but we don't have that review ground. And I would love to know that Aaron or Peter uses this or that. You guys, I trust you guys. It would be so cool.
And that's coming. And then, and unfortunately that's going to disrupt the dental industry and suppliers, just like it disrupted retail is when they do decide to pull trigger, which they're going to. And I think, Aaron, they've reached out to you as well, haven't they?
What's per the
Amazon.
Sorry. I talked to Amazon. I talked to the
so they're putting their sights on dentistry for sure. And Craig, that will for sure come. The problem when I talk to them, the problem is making sure that they're authenticated reviews with licensure and all that stuff, so that it doesn't become gamified like some of the other reviews do. Right.
Yeah, for
like
free
some
products.
Of them are fake, free products.
Let's face it. Look what's in our dental industry now. There's a lot of influencers that get money from products, and they sell it to us too. And we're finding out, later on it doesn't work. That's the same thing going on in our industry.
And that's kind of why I like to like show everything. So it's just me. Like you can put my stuff on mute and still get an idea of what it's like to use the stuff that I'm using.
Yeah. So, yeah, actually, Craig, I found that device. I don't know where I was looking for it. I think it was developed by a hygienist named Mark. And he does, Aaron, he does a lot of what you do, but with with equipment. He does a lot of reviews. I need to look for it and then connect you, because maybe you guys could do it. It would be cool to do a collaboration or something, because it's but he's testing a lot of dental products, whether that's hygiene I'll have to look it up. But anyway, maybe if a listener hears this and knows what I'm talking about, they can ping us and let us know. But that's it, man. That's really the only questions I got. I think we covered a lot. Software to cameras to disruption to.
Yeah, thanks for having me on,
Craig. Any burning questions, Craig, from the anti-tech dentist? Any burning questions that you have that you want answered? Now, remember, you're the proxy for those behind you, so just ask away.
I'm good, man. I'm not anti-tech. I'm excited about what's possible, and happy there's guys like the two of you to do the deep dive and look at all the zeros and ones on the screen and make sense of it all.
You are definitely not anti-tech. I'm busting your ball. Hey, Aaron, we talked about. Let me tell you a little funny story about the first time I walked in Craig's office. Number one, it looks like the Apple Store for dentists for dentistry. Huge, and it's like glass, and I have one Nomad in my office. Nomads that they are, right?
Yeah.
And actually, I just acquired an office and ripped the perfectly good swing arm, X-ray arm stuff off the wall, because I think the Nomads are just super cool, and my assistants love them. But I digress. So I walked in and literally walking through Craig's office. I looked on the cabinet and there was in the sterilization, and there was 6 Nomads lined up, all charging and ready to go. And then he had 3 3D printers going, and just some crazy stuff going on. So Craig, you are definitely not the anti-tech dentist.
I know, but I like to represent the old.
No, what's cool is that you've enlisted people, and this goes to a higher level conversation, but you don't love it, and it doesn't fire you up. So you've surrounded yourself with people in your ecosystem that do it, right?
Yeah.
Like the guy you were just texting with, you had him at the ready to answer your questions, which is really cool. So even if you don't love talking about terabytes and gigabytes and this and that, you actually have the chops because you have the people around you. So.
And that's something I find funny, because most technology is not made specifically for the dentist. It's made for the people around him or her, to makes the dental office easier versus actually have the dentist use it, which is kind of
truth.
Truth.
I like it.
Yeah. Pete, Aaron, I like what you're doing. You're going to be encouraging more and more. What am I trying to say? Better UI and UX from a software standpoint for dentists. You're looking at, exposing things, and I love what you're doing, man. And I encourage everyone to go and subscribe to his page and check it out, because there's some good intel there that I think will help us as dentists.
I appreciate it.
Hey, Aaron, guess what happened today? Something really monumentous happened today.
What's that?
Just take a wild guess.
I have no idea.
Okay, well, our registration for our upcoming Bulletproof Summit happened today. Early bird registration, the 2020 Summit. You know why 2020 is cool as a year?
Why is that?
Take a guess.
2020 eyesight has nothing to do with
teeth. Exactly. That's why people listen to you. Because you know what's going on. It's the 2020 Vision Summit, which is happening in Houston, Texas. Right down the street.
I wanted to call it. I wanted to talk about hindsight being 2020 and let that not. But Craig, we landed on Craig's having perfect vision, because he's a visionary leader, and that's.
Dude, you feel bad. You must feel bad from all the insulting and calling me a big dumb animal. Now you're getting better with me. But yeah,
I know.
It's open.
It's the balance of justice, dude. It's I can talk about but sometimes I do need to give you credit.
Yeah. So we got the summit opened up. The registration opened this morning at 9:24, and at 9:42, I saw tickets being sold, and I'm like, "What? That's cool." So
it's crazy.
We're excited to meet all of you guys February 28th in Houston. If you're from New York, I think they call it Houston, right? There's a street in New York.
No, they call it H-Town.
H-Town. Is that really true?
Yeah. Hey, Aaron, how's your marketing prowess for your
My
practice?
for my practice, that's going good. I try to keep the two things separate of the dental tech up in the office.
Well, of course, and the practice, of course. Well, it's your side hustle, as we say, right?
Yeah.
And you're a practicing dentist, and the reason I was saying that is like this is our third summit that we're having, and I actually had a call this morning. Craig was like, "Well, I went to is this like the other summits?" And I was like, "Similar, but it's going to be completely different content because like 2 years ago, shit is moving lightning fast. So this conference is going to be focusing more on the digital marketing and kind of scaling things and
a really influential leadership conversation from a really influential person, Jarek Robbins, who's an awesome dude.
No, it sounds actually really interesting.
Yeah, so vision leadership, and we're doing our own plug here, but it is pretty cool because it's exciting as we're kind of going through, the agenda of what we're going to be talking about. There's just so much cool stuff that's coming up in dentistry, and things are moving lightning fast. So we talked about disruption in this, and you see it in the industry of dental, technology, dental tech, but just as an industry and a business and consolidation and all these things happening, there's actually new data. Craig, our presentation is going to be different than from a data standpoint or an information standpoint than it was even just 2 years ago.
Oh, for sure. And Pete and I have another podcast that's coming up next week, where it's just him and I talking about theory versus practice. And I just want to leave everybody with a little tease. Unfortunately, those who are most influential in our field, as far as doing seminars and stuff like that, oftentimes many of those people have never actually practiced at the level that where they've had larger practices, multiple doctors, a couple $1 million in revenue, but they're teaching. So Pete and I are trying to go into the idea between theory and practice, and theory is cool, but practice and real specific knowledge in our fields is really important. So for those that are going to be signing up, if you don't earn 10 times more than you spent because of going to our summit, we're going to give you all your money back. That's pretty darn cool. Which I like.
Aaron, have you ever heard of a 10 times guarantee in all the CE that you've probably enlisted to go to?
I have not.
Yeah.
Well, now you have.
Now you have.
Now I have.
That's awesome.
I'm excited.
I'm just excited about it.
That was a great plug. Great plug.
Sorry,
and
but honestly, it's true.
I'm excited to do our presentation at Aurum.
Aurum Group. Aurum.
It's like that word I couldn't pronounce when that one podcast, and you just wouldn't. I don't know why I'm not having it. Aurum.
Yeah, that's a big deal. We're sharing the stage with Coyce, right? Coyce and who else? Like real
Stanley, Christian Coachman.
Yeah, right.
There's a lot of big dogs.
Yeah, either one of two things will happen, Pete. It's going to be a resounding success, or we're going to completely never be asked to come back again. But I have a feeling we're going to be asked to speak again, actually. It's the Evolution of Dental Medicine Summit. So we've got everybody. Theron Fleury, Gerd Leonhard, John Coyce, Hazel Glasper. Holy smokes. Kyle Stanley. Gotta love him. Love Kyle Stanley. Love his message. Yeah. Very cool.
So Aaron, if you want to come to Whistler, Canada, and hang out with us at the Aurum.
The Aurum?
There you go, Craig.
No, Aurum, buddy. I
don't think
it's like.
I bet.
Do you say Oreo cookie or do you say Oreo cookie?
Oreo.
Okay, then just do it. Aurum.
Right.
A-U-R-U-M. Aurum.
At any rate, I hope Mark doesn't get mad. I hope if Mark is listening to this, he doesn't get upset that I mispronounced it and Craig corrected me live. But anyway, we're talking about. I'm really excited about it because it's really, like I said, the disruptive areas of dentistry, and I think you get a lot from it, Aaron.
Yeah, no, it sounds really interesting.
Hopefully we can repost it after. Hopefully we'll have the rights for those who don't hear it. We can repost it on the podcast. But
that'd be cool.
Yeah, I think it'll be just. It's gonna be cool. It's gonna be like a TED Talk style too, which seems to be the way that all dentistry conferences are going. We went and spoke at DIA for the guys that's a great conference. And
DIA is awesome.
They have a shorter. We actually adopted that at our summits when we did have speakers. We do have speakers that's getting into like 20-minute blocks, like a TED Talk. And I think, success leaves clues, and they've obviously figured out the presentation style that's most effective, and people's attention spans wane in and out. It forces them to go right to the point. So me saying this. We've got
speaking of
30
attention span.
minutes. We've got 30 minutes to get our message across. I'm talking about global disruption in tech and software and industry stuff. So it's going to be, so we're going to have to come out swinging, right there, Pat?
Yeah.
Yeah. Hey, so listen, if you're liking this podcast, you like what we have to say, and we're influencing and moving the needle and helping you guys, we love hearing from you. Please rate, like, or share our podcast. It means a lot to us. That's why we do it. We want to give back. I mean, we're having fun, but we want to get back. Hey, last little thing I want to just say, crazy thing. Yeah. Check my story today. I met a guy who's a patient, who comes in as a patient here today. Really cool dude, dreadlocks, like looks really cool. And he's like, I'm the biggest fan of the podcast. I listen to every single one. I'm like, can you go find out if he's a dentist? And like, he's not a dentist. I'm like, what? God. So literally he's like, can you sign my book? He's not even a dentist.
That's awesome.
He's our one non-dental fan. So
I hope you gave him free. I'm gonna ping him and say, hey, ask for free dental work because
I'll give him free fluoride. Is that cool? Does that count? Free fluoride treatment? $36 value?
Yeah, your cost.
No, I'm kidding.
Sign trays.
Yeah, sign fluoride trays.
Remember those old school foaming trays you had as a kid?
Yeah. Oh, we still use those.
No, you don't.
No, I'm joking with you. All right, guys.
Aaron,
good talk.
Thanks for being a good sport, pal, and as always, continued success to you, buddy. And I look forward to kind of watching you and your YouTube channel grow.
Yeah, thanks for having me on here. I had a lot of fun.
All right,
cool,
pal.
guys.
Take care.
Take care.
Yeah. Bye.